This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
But I would also say within our nursing care, we really focus on what does it look like for us to provide a holistic care. As we look at the physical needs, how do we think about goals of care? How do we look at this, not just a person with a disease to treat, but a person with a name and a story who happens to have a disease that we are a part of providing care for.
This is the Heart of Hospice podcast with Helen Bauer. Nurse practitioner and author Juli Boit is here to share her story of working in a Kenyan hospice. Whether you're a family caregiver or an end-of-life professional, the Heart of Hospice is here to enhance your hospice experience by connecting you with information you can use about end-of-life care.
This episode is sponsored by International Doula Life Movement. International Doula Life Movement proudly presents their free online birthday bash from January 8 to January 12, 2024. The birthday bash is IDLM's gift to the doula community. This is an opportunity to connect with like-minded professionals, exchange ideas, and build lasting relationships that will elevate your death doula practice. Don't miss out on this incredible opportunity. Register now at internationaldoulalifemovement.com/classes. And remember, it's free.
I've never had a guest that's doing the work that this woman is doing. Juli Boit is an author, a community builder, and a nonprofit leader working at the intersection of faith, global health, and human dignity. For 18 years, Juli has lived and worked in Africa, founding and serving as International Director of Living Room International, which is a nonprofit, community-led organization providing hospice and palliative care services to adults and children in Western Kenya. As a nurse practitioner, Juli combined her dual passions of healthcare and social justice into a unique expression of love that provides desperately needed services in an underserved community. She would be the first to add that she's the one who has been most loved by her patients and neighbors in her home village of Kipkaren River, most notably by her husband Titus and their children. So you can find her at juliboit.com, but you're going to love this conversation. It's deep and it's rich, and I think you're going to grow from it because I certainly did. So here's my discussion with Juli Boit. Juli, welcome to the Heart of Hospice podcast.
Oh, thanks for having me.
I'm so excited to talk with you. I think you've got such an interesting story to talk about, very different from the other guests that I've had on the show. But I want to start with an icebreaker question just so my listeners can get to know you a little bit. I haven't talked about self-care in a while, so self-care is really a good thing not to get too far away from. So what would you say is your favorite go-to self-care habit right now?
Almost every day I go outside. I live in Kenya and the weather is beautiful year round, and we have the same amount of sunlight, so about 12 hours every day. And so I love to go outside and look for birds, and just I feel like walking and being in nature keeps me grounded. It helps me just to remember, like, I'm alive and there's beautiful things even when there's hard things too. And so I just feel like that's been a practice for me that has grown over time and has become something that's really, really valuable for me.
I love that. Such a balance, recognizing that there are hard things in the world, but knowing there's also good and seeking it out. That's a beautiful self-care habit. I love it. Okay, so we're going to jump into your stories. You live in Kenya, but you're an American, right? You're from the United States?
Yes, I grew up in Kansas City and I moved to Northern California when I was in high school. And then I had the opportunity to go to nursing school right out of high school in Southern California. And I finished nursing school. I worked in Los Angeles for several years at Cedars-Sinai Hospital in their infectious disease unit that focused on HIV at the time. And so, yes, I had a wonderful experience of beginning my nursing career here. I became a nurse practitioner. And then I signed up to go to Kenya for 1 year, and that was 19 years ago.
19 years ago. So what were you going to be doing in Kenya as a nurse at that point?
Well, when I was in nursing school is when I first had a chance to go on a short-term trip with my university and as part of the nursing program. And I was really moved by what I saw. I worked in rural villages in Western Kenya, and I met just remarkable Kenyan leaders who cared so much about the development of the community, the suffering of the people. HIV was really prevalent at the time, and it was before there was much access to testing or treatment, really any access to testing or treatment initially. And so when I actually graduated and started working as a nurse, I went into the field of HIV because I cared so much about what I had seen in Kenya and the larger pandemic that was happening across sub-Saharan Africa. And so when I signed up to go for 1 year, it was to be a part of a small nonprofit doing home-based care around HIV in rural villages. And so I wanted to go and work alongside of them and learn from them, and if I could be helpful, to be able to do that.
That is so interesting. So what year was it when you started working there in Kenya?
I moved to Kenya in September of 2004.
So we had HIV/AIDS here in the United States for several years at that point. Treatment was being developed. I couldn't tell you for sure if they had the AIDS cocktail, the HIV cocktail, but obviously treatment was much more progressed than there in Kenya.
Yes.
So you were looking at doing some really hard work there.
So I was moving from a hospital in Los Angeles in Beverly Hills, where we had access to all of the latest HIV antiretrovirals, and where it was becoming more of a chronic illness at that time for most people who had access to care here in the States. Where in Africa, where the prevalence was so extensive, the population of Kenya, like the estimates were between 6 and 10% were infected, and it was mostly people between the ages of 18 and 35, as well as babies and young children from mother to child transmission. So it really was an infection that was affecting the youth. It was leaving so many orphans, as well as middle age and older people to care for those kids. There was fear and stigma just around the idea of like not having access to treatment. And then even to say the word in Swahili, ukimwi, HIV, was just something that when I first got to Kenya was not something that happened. And I watched over about a 5-year period as testing was available and treatment was available, and strong Kenyan leaders and people living with HIV who began to say, I'm positive and I have treatment and you should be tested too. As I watched the fear go down and people who really cared and were willing to do things against cultural norms, it was remarkable to watch a transition of something that initially felt so improbable or maybe even impossible on many days.
It's amazing. So you were only 25 when you started working in Kipkaren River, the village where you're working. To me, at my age, that seems really, really young, especially as a new nurse. That's a pretty young nurse. How did that affect you as a young person? Such culture shock.
I had been to Kenya about 3 times before I moved there, so I knew what I was signing up for in many ways. Like, it wasn't the hardships of not having electricity or running water or just changes in diet or being far from home. Those weren't necessarily the hardest transitions for me. I was surrounded by remarkable community that welcomed me. I think it was more of the degree of suffering that I was seeing on a daily basis, the questions that were, didn't have clear answers, this I think the nights where I would lay in my little house and wonder how I'd gotten so far from home, and also like both as a positive and like what in the world is happening kind of thing.
Right.
But I do think it was mostly the shock of these people are dying of a treatable disease. And I so much believe that geography shouldn't determine whether someone should be able to live or die of a disease. And that's what our whole experience was at the time.
Interesting. When I got into hospice at the very beginning, it was like that for me. I had never seen patients that were so profoundly ill. And to this day, I remember thinking and telling my husband, this is obscene that a human body can be so sick. It was sort of a nursing culture shock, to go from a silo of healthcare where we were doing rehab and healing wounds and doing conditioning and strengthening to supporting quality of life and managing symptoms and pain for this severely progressed illness. It affects us. It affects our mindsets. And we have to look for these beautiful moments and the chances to make a difference. And I think that's what I hear you saying, is you realize there were great opportunities to be part of what was happening in Kenya to take care of these people.
Yes, and I think the opportunity, kind of what you're mentioning, is the opportunity to pay attention to the names and the stories and the human elements that still were in the middle of the suffering. So the beauty that you'd get glimpses of. And for me, most of the people I was taking care of were about my age. So even though I was a young 25-year-old single nurse, these were young 25-year-old, 30-year-old people who were at the end of their life. And that was another element that was, a lot to try and process.
I can imagine. So how is hospice philosophy, end-of-life care, how is that viewed in Kenya? Is it received the way it is here in the U.S.? Are there myths? Is there, mistrust? How is hospice seen in Kenya?
I would say the word hospice is very much associated with death and end of life, and a foreign concept to most of the population. Even I would say there's a lot of fear and stigma within healthcare professionals. So the Ministry of Health for Kenya still does not recognize hospice as something that can be reimbursable within care. So if someone is considered end-of-life care, then typically, if they're not able to pay, then they would be discharged to home. And there's not really a home care model like what you would think of as far as in North America around hospice. So they're often referred to home for home care, but it's not like many of the people would have electricity. So if they needed an oxygen concentrator, that wouldn't be something that would be, readily available. If someone needed symptom management, then often families would be kind of responsible for providing that. There are freestanding hospices that they do some sort of home visits, but as far as having in-home service readily available, that's not so much for most of the country. As far as the philosophy of hospice, I think it's still really a new concept within healthcare and within Kenya. It's not, I don't think it's really, for the most part, seen as valuable. Now, there have been wonderful Kenyan leaders who have been working to change that and advocating within the Ministry of Health and advocating within nursing schools and medical schools to provide education around hospice and palliative care, and even to have access to things like liquid morphine or, pain management. But it's still, I think it's still a long ways to figure out within Kenyan culture, which, there's multiple tribes with many different beliefs around death. So it's not like it's one culture within Kenya. There would be many that you would need to navigate.
Interesting. That makes the care very complex when you try to design care that is individualized for someone. And that's really, I guess, not too different from the United States, how we practice hospice here. But did you encounter some resistance to you individually as a white person coming from the United States into end-of-life care in Kenya?
So I had been living in Kenya for 5 years, doing community-based, in some ways, like a hospice and palliative care at times for people living with HIV and AIDS, but also just doing home care with all Kenyans. And with the Kenyans that I was working with, I was listening and learning from them. I was well received by them, and the community where I live is where we work. And so I'm also I've been able to become a part of that community in so many ways. But it was Kenyan leaders who would say, she's bringing something of valuable, let's receive her. And they would be the voice to the community. So it was never me going and saying, I'm going to bring hospice here. It was me working within a team and us together bringing elements of care that eventually led to us starting hospice, both inpatient, community-based care, working with already established HIV programs that could refer patients. In time, that would lead to us working with government hospitals to refer cancer patients or other populations. And I would say that our hospice home, which is a 24-bed inpatient facility, it wouldn't fit the exact model of hospice within the States. It has some rehab components to it. It has a lot of pain and symptom management within it. Especially with our HIV population, the goal is not, for the most part, is that it's not going to be end-of-life care. They look like they're dying when they come to us, but with the right medications, the right symptom care, the right, we focus so much on psychosocial and spiritual care, like the reminders that you're valuable, that there's still love and life for you, is so much of what we do. And many of those patients actually would come back to life and be able to go back to the community. So I think if we would have, somehow explained this is a home for the dying, like culturally, no one would want to come to that. Maybe that's true everywhere. It's like, it's a place where we actually call it living room, where it's about how can we help to reduce the suffering and improve your quality of life while you still have it.
Yeah, I think that resistance, people are resistant to hospice houses here in the United States. Freestanding units, I think they do view them as places of death. Hospice staff, we just think about it differently. It's different for us. So do you guys employ a psychosocial spiritual team, an interdisciplinary team in Kenya? At like social workers and chaplains. Do you have faith counselors or spiritual counselors on your team?
Yeah, so at this point, we're running 2 locations, both inpatient, community-based care. We have 150 staff. And so we have physicians, nurses, we have social workers, counselors, we have chaplains. So yes, we do have an interdisciplinary team and really approach everything from that. But I would also say within our nursing care, we really focus on what does it look like for us to provide a holistic care. As we look at the physical needs, how do we think about goals of care? How do we look at this not just as a person with a disease to treat, but a person with a name and a story who happens to have a disease that we are a part of providing care for.
Yeah. Are you the only Westerner on the team, or is it a mix?
So there are 2 of us who are from America. My other colleague, she's lived in Kenya, and we've worked together for the whole time that I've been there. Her background is in public health, and we really have been privileged to work with remarkable Kenyan staff and grown it over time.
This episode is sponsored by International Doula Life Movement. International Doula Life Movement proudly presents their online Birthday Bash from January the 8th to January 12th, 2024. And the best part? It's absolutely free. Join International Doula Life Movement for 5 days of inspiration, education, and celebration. This virtual event brings together nurses, doulas, and authors specializing in end-of-life care for an unforgettable experience. You'll be diving into intensive training sessions led by experienced nurses, renowned death doulas, and best-selling authors. Learn the latest in death doula practices, discover new techniques, and expand your skill set. The Birthday Bash is IDLM's gift to the doula community. This is an opportunity to connect with like-minded professionals, exchange ideas, and build lasting relationships that will elevate your death doula practice. This is your chance to learn from the best in the business. Explore the many facets of death doula work, whether you're a seasoned professional or just starting your journey. Uncover the various roles death doulas play and discover the unique contributions each type brings to the end-of-life experience. Don't miss out on this incredible opportunity to celebrate International Death Doula Life Movement's online Birthday Bash, January the 8th to January 12th, 2024. And remember, it's free. Register now at internationaldoulalifemovement.com/classes.
Your organization is called Living Room International. Tell me about Living Room International and how it got started and what exactly your focus is there.
So Living Room International, it was started in 2009, and it came from the five years of doing home care and seeing patients who really needed more. They needed to be able to be in a place where they could get more symptom management, more pain management that wasn't easily available or possible to do in the homes. And so I was working also within HIV clinics where we were referring patients to government hospitals to die. And I knew that within those settings that there were already 2 to 3 patients per single bed, and the number of nurses to patient ratio was just so many, and that the care that they needed was something different. And so we began to think, how could we do it in a small scale? And so we started that and then grew it over time to be able to in Swahili, we call the hospice home, we call it kimbilio, which means refuge or a place to run to. And so, how could we create a place that would be a refuge for patients and families to be able to come? And then what we began to do is kind of organically it started is that we decided not to call the people who came into the hospice a patient, but referred to them as guests. And so we call them wageni, which it just felt like an important piece of how do we receive the people who might come into our doors? How do we honor them? How do we listen to them? How do we see them and their loved ones? And so that's what we've done.
I have several questions as a hospice nurse as to how you guys manage all of this. So, what kind of access to medications and opioids do you have there?
So mostly we use liquid morphine, almost extensively. That's what we have available. And it actually has worked very well with our patient population. I don't know. I mean, it would be really interesting for someone to do research along this, but I don't know if it's because the expectation around pain relief is different or if it has to do with somehow just a relief is different. But almost all of our patients get really good pain control with liquid morphine.
Interesting, because I know there are some countries where access to narcotics is very, very limited. So Kenya must not be one of those places.
Well, Kenya is one of those places. That's changing some, but I guess I'm speaking more from the way that we have worked to make sure that we have it all the time. And so the patient population that we care for within the community and within the hospice, that is where I've seen the relief. But without a doubt, there are still people throughout Kenya who are living in rural villages or even in urban settings and don't necessarily get access to the pain medicines that they would need for the levels of suffering that they have.
What percentage of the people that die in Kenya are dying at home?
I don't know if we have those numbers. I haven't seen them, and I work in hospice. So what I would say that I've seen a lot of is for people who can afford to go to the hospital, then family members are the ones who actually make the choices around healthcare, typically for seriously ill people, and they would take them to the hospital as long as they can pay. If they can't pay, then they'll be discharged. But even within many hospitals, getting regular, routine receiving the medicines that you need can be tricky. So if you're in government hospitals, again, where there might be 2 or 3 patients in a bed and where the nurse ratio is, it can be 1 nurse to 20 plus patients, then that obviously makes it really hard to be able to give quality care.
Right. The staffing shortages that you deal with. Julie, advanced care planning conversations are a huge focus here in the United States. We talk about this constantly, how we need to have them earlier and how we need to have them often, and we're lousy at having them, and people don't want to have them. So, it's like pulling teeth to get those advanced care plans done. Is there any conversation about advanced care planning among the Kenyan people?
So I would say that there's growing elements of it, mostly within probably urban areas, so Nairobi, Eldoret, Kisumu, but it's not. It's going to take a long time, I would say, before it's used readily within the healthcare system. Even for us running the hospice, we don't often call it advanced care planning, but we're definitely doing family meetings. We're talking about prognosis. We're talking about goals of care, and trying to do it in culturally sensitive ways. But we have wonderful social workers who the way that they navigate those conversations has been really, I've been really impressed, and it's felt remarkable to watch something that even a couple of years ago culturally was so sensitive and hard to think about. I do see change, and I think it'll take time for sure. There are elements within culture that talking about death is like hastening it to come. So just being sensitive in how to navigate that is like really important. And thankfully, because we have Kenyans who are doing most of those conversations, they're navigating them.
Sounds like actually the perception or the beliefs around having those conversations about death and dying really aren't that different between Kenya and the United States.
Yes.
I don't think they would define themselves as being superstitious, but there is sort of an unspoken belief that if you discuss it, somehow you're making it happen. You're making it real by speaking it into being. And of course, we know that's not true, right? We talk about, I've been having conversations about death and dying for the last 14 years, and I'm still alive. It sounds like the Kenyan people have the same sorts of perceptions that Americans do about talking about their deaths.
Yeah, I think that there are universal elements of the fear and also just beliefs around, or like you use the word superstition. I would say that those elements do definitely exist.
Yeah, I don't know that we would call it superstition or that we would name it that here in the U.S., but I think that's some of it. Maybe that's a watered down word or an old word, but that's kind of what comes to my mind. You know, somehow if I talk about it, that it'll happen, and we know that's not how it works.
And I would say the other thing that I've seen, especially around like Kenyans who many would say that they're Christians. And so they would say that to talk about death in this way is somehow to let go of hope. And so I think for me, there's a reframing of, well, what is hope, and how do we lean into the things that we still maybe believe from a faith perspective? Like just how to think about it. What are our conversations going to look like, where we can still have hope, or we can still have faith, and also have certain things that are, like feel like, but death is coming. What are the things that feel important to you at this point? So like how to navigate, whether that's said explicitly or not, how to think about it.
Yeah, that must be just generalized human nature, because I think that's exactly the kind of attitudes we find here in the U.S. as well. We don't want to rob our patients of hope, and patients don't want us to steal that from them. So consequently, everybody who's in the room knows the elephant's there, and they may kick at it a couple of times, but the elephant's allowed to just stay there without being questioned, because it makes us uncomfortable. And the miracles, people want to hope for miracles. And it's my view as a hospice nurse after 14 years that miracles come in all different forms. Very, very big life-altering miracles, and then tiny little moment-to-moment altering miracles. And I think that's where faith and hope and spirituality sort of all come together. It's all wrapped up in there together when it comes to providing care at end of life.
And I feel all of that so deeply. And I think that there needs to be room for the joy and pain, the hope, and the possibilities of what's, about to come, to sit side by side. That there can be, we see it so often, like there can be moments where we're somehow laughing together or rejoicing together, and there's the moments of weeping together. And to me, I feel like what has been powerful is doing that within community. So not as an isolation feels like one of the things that I think for me would have led to burnout many years ago, but feeling like we're doing hard things together has been one of the things that has held me for a long time, um, and our team, and feeling like there has to be room for both the joy and the sorrow. And I think, just back to what we were talking about, I think there needs to be room for the hope, but also for the lament of also what, that death is near.
Yes, what's being lost. Yeah, I have a grief colleague that talks about it as the both and. There's room for joy and grief at the same time. There's room for laughter and tears in the same space. And it's an incredible human balance that I think enables us to look at who we are as humans as these multidimensional beings. We are going to feel all those things. We're created with all the potential for all of those different emotions. So why shouldn't there be joy in remembering someone after they've died, even inside your own grief? I think that's very human, very normal. So you mentioned burnout just momentarily a minute ago. I want to talk to you about that because the work that you're doing, I mean, let's face it, everybody who works in end-of-life care and hospice, we struggle with that. Compassion fatigue, secondary fatigue, and burnout. It's sort of a occupational hazard that we deal with. What has challenged you personally during this time that you've been working in Kenya with end-of-life patients?
Well, interestingly, I think the thing that made my work another level of challenging was becoming a mother. So feeling things so differently after I became a mother was one of the things that I've had to navigate and process. And then when through adoption, becoming a mother to multiple children living with sickle cell disease, their suffering had initially actually really made it hard for me to do some of my work for a good number of years, actually. And what I think is, I'm now 7 years into this journey of being a mom to kids with chronic illness. And I think where it once felt crushing and like I didn't have the space for all that was in front of me, I feel more and more like a reshaping of the way I see patient care through the lens of also being a mom and being a mom to kids who've been in the hospital a lot. I think where I needed to step back from certain elements of my work for a period of time to be able to care for my family. At this point, I feel like as I've been able to step back in new roles, that my heart has expanded in ways that I didn't know before, and compassion has grown within me and has made me ask questions that I think actually are helping me to be a better nurse. But it definitely has taken time and taken therapy and taken breaks for me to get here.
Yeah. So it's the perspective that you gain from being a caregiver. Yeah. And being a griever on a personal level, because we are professional caregivers, right? We're professional grievers. We have secondary grief as we watch people suffer. But when you are placed in that role for yourself, you watching your children be so very ill and then receiving treatment and hoping for recovery and watching all of this happen, that's some really valuable perspective. But it comes at a cost. That's very painful for us to take that back. Did you find that when you were caring for the patients or the guests, as you guys call it, that you found their experiences more relatable and that grief was much more tangible for you as a care provider?
Well, I'd say that when my son, who was 19 months old and had had a bone marrow transplant, was lying in the ICU on a ventilator, and the palliative care team would come in, like I didn't want palliative care people to need to come into my room, and so like I remember a day sitting beside my baby and feeling like I'd like to write a letter of apology to all of the parents who I've taken care of their kids before. I didn't know how much it would hurt. And I mean, I think that reshaping, that reframing, as I've come back in and am doing quite a bit of work around care for seriously ill children and their families. Like I I just I feel it differently, but not in a way that makes it impossible for me to, you know, be the professional caregiver again. But there's definitely an empathy within me, a compassion, and a willingness to ask questions of what care do we need to be providing, that might look different than what I would have imagined several years ago.
Yeah, it changes you.
Yeah, and it's not always about like centering my story or our situation into other people's, but I do feel like I have been changed in a way that as you mentioned, it was costly. You know, it was deeply costly and painful, and one that I don't know that you yes, there's healing that comes, but there's also scars, and just navigating all of that, while also wanting to still have the eyes to see and the ears to hear and like the hands that are willing to step into spaces and to lead teams of other nurses, and also to sit alongside of mothers and their children and want access for care for them, in a new way.
Yeah. I love what you're saying. I had tears come to my eyes when you said that about wanting to write a letter to the parents of children that you had taken care of, and you know, to apologize to them. I think what it is that once we've experienced this for ourselves, it eliminates what I call the luxury of distance, because it's easy to look at somebody else's stuff when it's not yours and say, oh, I get it. I get it. When in fact, I have had patients or caregivers tell me, if I said, oh, I understand, they would actually tell me, no, you don't.
Mm.
You can't understand this. You've never lost a child. You know, they would ask me, are your parents still living? Yes. Then you can't understand this because you've never actually gone through it. But to be able to sit alongside someone, to be able to sit along the mother of a critically ill child for you, and to say, I understand. I see where you are. I have been there and I understand. That's an incredible gift and skill to have as a nurse. I think it causes growth. It leaves scars, like you're saying. But I think we can use it as growth to expand and enhance the kind of care that we give as nurses.
Yeah, I think both as a nurse and then also as someone who works heavily within administration. So asking the questions related to access to care, affordability of care, what are the barriers for these kids? All of these kinds of questions have also really surfaced for me and our team. And it's been one of the things that we are able to do this past year is, so for my children, when they needed bone marrow transplants, so we had two sons with sickle cell disease, and we were able to do bone marrow transplants here in the States for them with a matched sibling donor. But it was a family who welcomed us in Los Angeles to stay with them for 477 days. That also, that sense of hospitality, that sense of like your children, their survival, their healing matters, and we're going to make room in our lives, led us this year at Living Room to create a guest house. So a 64-bed guest house for kids going through cancer treatment at a government hospital, for them and their families to be able to come from all over the country and have a place to stay. And kind of what I was mentioning of I do know what it is to become the guest, to go from being the host to guest. And now when I think about how we welcome these families, how we make room for them, how we walk alongside of them, um, it feels like really important and sacred work to give these kids a chance at cure, but knowing that many of them that they will not be cured of their cancer, and the opportunity that our team has both to provide the physical and emotional and spiritual care for the kids as well as their families.
It's amazing work. Juli, if you could go back and give your 25-year-old self some advice, what would you tell yourself?
Oh, I would tell myself that keep asking the question, what does it look like to love um, in the situation in front of you? And try to do that over and over again. Like, don't look too far ahead. Don't make really big plans. Just keep trying to do the thing that feels right and loving in front of you. And that it will guide you, it will lead you along the path.
That's beautiful. Living in the moment and seeing it as it is. Wonderful. Juli, how can my listeners find your work, find your website, and pre-order your book, Love Makes Us Brave? How can they find it?
Yeah, so I have two books. The first one is called From Beyond the Skies. It's the story of my kids, our family's journey through transplant. And then the second book is called Brave Love. And it is about coming home and from transplants, but then also it chronicles nearly 20 years of doing hospice work in Kenya and how the stories have somehow woven together into who I am and who I'm becoming. And so you can find more at juliboit.com. So my parents, I'm not sure why, but they typically are rule followers, but they didn't spell my name with an E. So it's Juli Boit, BOIT.com. And you can find all about Living Room and the books and connect with me there. And then I'm also on social media. So you can find those also at the website.
Awesome. I'll put some links in the show notes so listeners can go in and find you. Juli, thank you so much for sharing your story and this expansive heart of yours that keeps you doing this work in Kenya. Thank you so much for being on the show.
Thanks for having me.
So you've heard this incredible story about Juli Boit and the work she's doing through Living Room International. You can find her on social media. You can access her website, juliboit.com, and it's JULIBOIT.com. Check out her documentary, The Space Between, and pre-order her book, Brave Love, A Nurse's Story of Courage and Compassion in a Kenyan Hospice. So connect with Juli Boit. You're going to be just so encouraged and inspired by the work she's doing. Be sure to catch the next episode of the Heart of Hospice podcast. You can find more episodes on theheartofhospice.com. Don't forget to follow us on your favorite podcast platform. You can connect with the Heart of Hospice on Facebook and Instagram and send your questions or comments by email to helen@theheartofhospice.com. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.
This is the Whole Care Network. Helping you tell your story one podcast at a time.